When House Republicans couldn't get enough votes for their health care plan, they pulled their bill from a scheduled vote. President Trump then said it was time to move on. But some are now trying to breathe life into the new bill. One America's John Hines has more from Washington.
Although the House health care package never came up for a vote and was presumed dead, rumors of a new health care agreement involving the House Freedom Caucus persist, despite denials from some.
Congressman, could you talk a little bit about health care, sir?
No, we just nothing new to talk about.
Notwithstanding the comments of Ohio Congressman Jim Jordan, on the other hand, maybe there is something happening. And if you ask Senator Rand Paul, you'd get the impression that he at least is trying to nudge along his fellow conservatives in the Freedom Caucus.
The sense I got from the House Freedom Caucus is they're still open to discussion. They still want to have good communications with everybody on it, and they are still trying to find a middle ground for everybody to get Obamacare repealed.
While the Freedom Caucus may be open to discussion, a sticking point for repeal continues to be a fear of making things worse, says Paul.
They could go along at any point in time and just say, oh, we'll take half a loaf on this thing and we'll vote for whatever this repeal is. But they don't want to take responsibility. We don't want to take responsibility for making the situation worse. So there still has a big sticking point is the insurance regulations, the Title I regulations, that we want to make sure that the death spiral of Obamacare is fixed.
And fixing that death spiral of Obamacare is probably the number one objective of any replacement health care plan, says Jason Pye, Director of Public Policy and Legislative Affairs for FreedomWorks.
What we're hearing right now is that there's the possibility of a deal or a proposal to allow the Department of Health and Human Services, Secretary Tom Price, to allow states to opt out of many Title I regulations, and that's where the cost drivers are for health insurance premiums in Obamacare. This would include the essential health benefits, those mandated benefits that insurance companies have to cover, as well as community rating, which is another cost driver of Obamacare.
Cost drivers indeed. In fact, says Pye, it is these mandatory aspects of Obamacare that are to blame for most of the health care plan's rising costs, according to a recent study.
Heritage Foundation just recently put out an analysis showing that that Title I is responsible to 44% to 68% of Obamacare's increase in insurance premiums. So no, health care is not quite dead yet, but its prognosis remains uncertain. John Hines, One America News, Washington.